If our job is to serve patients, then technology helps us to do that at a higher quality and lower cost. And that matters. Healthcare in America, the cost is rising. There's more of a need for it, and it's not going away.
Schumacher Clinical Partners is primarily emergency medicine management, practice management. So we've got over 400 client hospitals, some variation between emergency medicine, hospital medicine, telemedicine, and urgent care.
The industry is changing. Reimbursement models are changing, and that creates challenges within the industry to provide quality care and still net the value needed to continue.
Providers in this sense are our physician community, or spread throughout the country. They work varying shifts, but you can imagine that communicating with them is a challenge. We solved that particular communication challenge with a mobile app that is available on Apple and Android platforms, where the provider could download it and have meaningful communication between SCP, the SCP community, and himself, as well as his other peers within the hospital or his leadership. Those avenues for communication were otherwise not available. We selected DevBridge to do that work with us and to be our partner, because we felt that DevBridge was culturally a fit. I really enjoyed working with DevBridge on what we called the whiteboarding session, where we put sticky notes up on the wall. We really were able to facilitate the core features really quickly. That was really beneficial in kickstarting our MVP product.
If it's a computer system or an application or a mobile app, in our case, it is to put power or to enable, in our case, a physician or a nurse practitioner or some other clinician to deliver value.
When we deployed our first app within 6 weeks, we thought this was remarkable. We've seen an 86% adoption rate, which is phenomenal in the physician community. We continue to monitor and have metrics and analytics behind mySCP to ensure that the features we're deploying are meaningful and being used, and we've got adoption.
Our job is a people business. It means getting a provider and a patient together at the right time that care is required, and doing that very well. So technology is really about enabling that connection.
And at the end of the day, the provider will have features available to make him better, and I do believe that sets us apart from our competitors.